CCHT 2025 Study Guide Exam Questions. At Mrs. Chase's next treatment, the technician suspects that her access is clotted. The technician's suspicion would be true if a bruit was absent. The technician is asked to move a heavy box of supplies to the treatment unit. The box is on the floor of the supply room. When handling the box, the technician should hold the box close to the body. Which of these parts of the water treatment system removes endotoxins? Ultrafilter. A hemodialysis patient tests positive for hepatitis B surface antigen. The technician should take which of these actions to prevent the spread of hepatitis B? Dialyze the patient using a dedicated machine in an assigned area. A patient's laboratory results reveal a significant drop in hemoglobin. Which medication would the technician expect the nurse to administer to the patient? Epigen, erythropoietin. Which of the following occurs when the dialysis machine alarms and goes into bypass? Dialysate stops flowing through the dialyzer. Care providers must wash their hands with soap and water instead of using an alcohol-based hand rub in which of these situations? When their hands are visibly soiled. A patient asks the dialysis technician, "Why am I getting vitamin D therapy?" Which of these responses would be accurate? Vitamin D is needed for healthy bones. At her target post-dialysis weight of 154 pounds 70 kilograms, Mrs. Chase is likely to be normotensive. A patient asks the technician, "Why do I need ultrafiltration profiling?" The technician's response should be based on the understanding that the purpose of ultrafiltration profiling is to minimize hypotension. Mrs. Chase overhears a nurse discussing a QAPI, quality assessment and performance improvement, meeting and asks, "What does QAPI mean?" The technician should understand that the primary goal of QAPI in a dialysis facility is to achieve better patient outcomes. A patient asks the technician, "What does uremia mean?" The technician's response should be based on the understanding that uremia is an increase of wastes in the blood. The technician is unsure which one of a patient's arteriovenous, AV, grafts anastomosis is arterial and which one is venous. In order to differentiate between the two, the technician should compress the graft in the middle and palpate each side. The technician notices that Mr. Jackson has a notebook in which he records results of his blood tests, weights, and medications. The technician should have which of these understandings about Mr. Jackson's record keeping? Patients who are involved with self-managing their care feel empowered. Which of the following practices helps to build a patient's immunity to hepatitis B? Vaccination. In hemodialysis, the term reuse refers to the cleaning and disinfecting of dialyzers. A 30-year-old male, new to hemodialysis, is scheduled for treatments at 6 a.m., 3 times a week. He tells the technician, "I've walked a mile every morning for years. I guess I'll have to give that up now." Which of these responses by the technician would be best? Explore changing his dialysis schedule to hours that would let him continue his usual routine. A central venous catheter may be used as a vascular access when a patient has inadequate blood vessels in the limbs. 12. During the last hour of his hemodialysis treatment, Mr. Jackson's blood pressure measures 82/40 mm Hg. After changing the fluid removal rate, the technician should take which of the following actions? Place in Trendelenburg position. A patient asks the technician why a high venous pressure alarm is sounding. The technician should explain that a high venous pressure alarm might indicate clotting of blood in the access. A shortage of oxygen-carrying red blood cells is called anemia. The technician would expect anemia to be monitored by which of these laboratory tests? Hemoglobin. The most common cause of a low conductivity alarm during hemodialysis is an exhausted concentrate supply. Before a dialysis treatment, the patient tells the technician, "Yesterday, I felt terrible and vomited up some blood. I feel much better today." The technician can expect the patient's treatment will be modified by decreasing the heparin dose. At the end of a patient's treatment, which of these findings, if observed by the technician, should be reported to the nurse? A pulse rate of 55 beats per minute. Why are dialysis patients more likely to become infected with germs like methicillin-resistant Staphylococcus aureus, MRSA? They usually have weak immune systems. A patient who has diabetes mellitus should be observed for signs of low blood sugar, which include anxiety, confusion, hunger, sleepiness, or dizziness. Mrs. Chase's weight before her hemodialysis treatment today is 158.4 pounds 72 kilograms. The technician determines that the fluid to be removed during today's treatment should be how many ml? 2000. Legally, if a treatment was performed but not charted in the patient's record, it was not done. After her hemodialysis treatment, Mrs. Chase's standing blood pressure is 90/58 mm Hg. She complains of feeling dizzy but insists that she can walk to the scale. The technician's initial response should be to instruct her to sit down. Mr. Jackson says to the technician, "The doctor says that I have mineral bone disorder. What does that mean?" The technician is not sure about the answer. Which of these responses by the technician would be appropriate? It's pretty complicated. I'll ask the nurse to explain it to you. The technician prepares and cannulates Mr. Jackson's arteriovenous, AV, fistula. An AV fistula is an example of peripheral access. Mrs. Chase begins her hemodialysis treatment. The water supply to the water treatment system is called feed water.